I will give an update on COVID-19 in Namibia, and I would like to say that it's not a pleasant prelude to a weekend. Today, a total of 946 results were received from NIP, UNAM, NAMDEB, and PathCare. Out of these, 182 samples tested positive for COVID-19. 97 are female and 85 males. The youngest one is 1 year old, and the oldest is 85 years old. They are distributed as follows: Walvis Bay, 58, Swakopmund, 16, Windhoek, 91, Gobabis, 5, Okahanja, 2, Okakarara and Ochuarongo, 1 each, Oshakati and Loderis, 3 each, Rundu and Katima Muliro, 1 each. Total 182. One case reported from Windhoek is of a 47-year-old female, a resident of Rehoboth, but works in Windhoek. The Rehoboth district is informed to initiate contact tracing. Yesterday, among the number which we announced yesterday of the Windhoek cases, 15 of them are health workers. We have also noticed that there has been cases coming from Arandes, but because of our report per district, they were reported under Swakopmund. Among the cases from Swakopmund, which I announced today, 2 of them are from Arandes. 2 cases reported from Okahanja. They are both from Oropoko, where we have reported more than 30 cases. A case reported from Okakarara district is that of 28-year-old male from Okamatapati, a contact of a confirmed case. He was tested on the 7th of August because he presented with COVID-19 related symptoms. The case from Ochuarongo is that of a 60-year-old male with no known contact to a confirmed case. He was tested on the 7th because he presented with symptoms. The cases from Gobabis district, they are as follow: 1, 37-year-old female from a Pukiro with no known contact with a confirmed case. He was tested on the 5th of August before being referred to Windhoek for medical attention. The second one is a 24-year-old male from Gobabis with no known contact to a confirmed case. He was tested on the 9th because he presented with symptoms. The third one is a 53-year-old male and the contact to a confirmed case in Windhoek. He has been in the quarantine. The fourth is a 28-year female, a contact to a confirmed case in Windhoek. She was tested because she displays symptoms consistent with COVID-19, but she has been in quarantine. Then a 27-year-old male with no known contact to a confirmed case was tested on the 10th of August because he displayed symptoms. From Katima Muriro, we have a 20-year-old female, a Zambian national, who is studying in Namibia. She returned back from Zambia and had been in quarantine. And from Rundu, we have a 27-year-old male and a contact to a confirmed case because he traveled from Walvis Bay on the 1st of August. He did not have symptoms. The 3 cases reported from Moshakati as follow. 1, a 28-year-old female with no known contact to a confirmed case. She was tested because she displayed symptoms. 2 other cases from Moshakati are resident of Ngwediva, aged 25 and 26 years old, 1 male and 1 female. They are both contact to confirmed cases, and that's why they were tested. The 3 from Luderis district, they traveled from South Africa and all had been in quarantine. Today we have a record number of 1,494 recoveries. From Irongo, 1,458, Karas 16, Komas 13, Ohangwena 5, Zambezi 2, and then all total 1,494. Of the active cases, 4 are critically sick, 1 from Walvis Bay and 3 from Windhoek. Again, 14 are in severely sick condition, 1 from Walvis Bay and 13 from Windhoek. Again, it's saddening to report more deaths, 1 from Swakopmund and 3 from Windhoek. Details are as follows. 1 is a 48-year-old male from Windhoek who presented to a local health facility on the 4th of August with symptoms consistent with COVID-19, was tested on the same day, and the result came out positive. The patient is known to have multiple comorbidities, was admitted in a severe state, and died on the 13th of August. Second one is 83-year-old female, also with comorbidities, was admitted on the 10th of August in Windhoek Hospital because she experienced respiratory symptoms. She was tested on the same day, but on the 14th day in the morning, her clinical condition suddenly deteriorated and she passed away. The result tested positive for COVID-19. The third one is a 68-year-old female from Windhoek who also presented to a local health care facility on the 6th of August with surgical complaint and was admitted. She is known to have multiple comorbidities and later developed symptoms consistent with COVID-19, was tested on the 11th, and the result came out positive. She died on the 14th of August. From Swakopmund, we have a 48-year-old male who presented to a local health facility on the 6th of August with symptoms consistent with COVID-19. The patient was tested on the same day and admitted to a local health facility. The patient died today on the 14th, and the results confirmed positivity to COVID-19. We also have an unusual situation whereby a 9-year-old female from Walsh Bay passed tragically after she fell from a height on the 12th of August. The case is still being investigated by the police. But it is also known that when she was tested, the result came out positive to COVID-19. This one, according to our classification of deaths, which is consistent with the policy of the World Health Organization, is not counted as a COVID-19 death. We now have a cumulative number of 3,726 confirmed cases since the beginning of the pandemic in Namibia. We have a total of 2,342 recoveries. The number of active cases stands at 1,353. The death toll have climbed to 31. That 8,743 samples have been tested so far. Active contacts stands 4,344. So far, we had in our quarantine facility a total number of 7,830, of whom 6,352 have been discharged. And as of today, we have 1,478 people in our quarantine facilities. We have recorded high fatalities due to COVID-19 within this week. In fact, within the past 3 days, we have recorded 12 deaths. These deaths once more underscore the fact that we are dealing with a serious disease which calls for seriousness on the part of the citizens. The major responsibility to prevent further transmission and further deaths lies with the public to comply with the measures put in place in order to prevent more morbidities and mortalities. We are disturbed and disappointed by reports that some Namibians are leaving the restricted areas through illegal exit routes to other parts of the country, which are not under lockdown. The reason for imposing restriction on Khomas and the Rongo regions is to contain the infection, not to spread to those regions. Movements of people from the restricted areas has the greatest potential to introduce the infections in those regions that are currently having few cases of COVID-19. I should also remind the public that leaving the restricted areas without permission is a punishable offense. The law enforcement agencies are on the lookout to arrest the offenders. I call on the public to report those who are running away from the restricted area to the police, as some have already done so that appropriate actions can be taken against those offenders. On this note, let me wish all the Namibians a pleasant weekend. I thank you.